Next, when we see patellar tendinopathy, it is also known as jumper's knee. With the name itself, we can understand that it is involved, or it is seen mainly in people who has a requirement of repetitive loading on landing, deceleration, acceleration, or cutting activities, such as sports activities, the basketball players, the volleyball players, the football players, tennis players, pickleball, paddleball, or even the jumpers, especially when they have to do all these activities in a hard surface. Now, the pain location is very appropriate or localized, we can say. It is anteriorly the front of the knee at the inferior pole of patella. Now, we also have few people or rare symptoms wherein there is superior pole of patella showing up the symptom. There can be swellings and tenderness on the inferior pole of patella. Now, as we all know, tendinopathy has its own pathophysiology. It all depends on the load pattern. It all depends on how there is increased demand on the knee extensors, notably in activities that store and release the energy in patella tendon. And with insufficient rest, there can be micro tears in the knee extensor tendons, and hence there is tendon disrepair and then degenerative tendinopathy. Now, it is very classic here that people can have no pain at rest, or rarely people has pain at rest. Okay, load related pain we all say it as, right? So that's why loading shoots up the pain and offloading seizes the pain, and repetitive loading can improve the pain in a long term, as we all know that heavy slow resistance exercises can help in these conditions related to tendinopathy. Demographically, when we see people with overweight, people age ranges between 15 to 30 years old, the younger athletes basically, and mainly the men more than women. Nowadays, even women are having these patellar tendinopathies. That is another point. And people having hyperpronated foot. Now, this is again seen in patellofemoral joint syndrome, patellofemoral pain syndrome as well, that there can be an hyperpronated foot, or there can be an increased pronation of the foot, and the process I have already explained. So similar way it can trigger this patellar tendinopathy. Now, what all activities increases or leads to this type of patellar tendinopathy are basically jumping, hopping, running, squats, the deeper squats, and as I said, the pain is present when the person is going down the stairs, people who are sitting for prolonged period of time, when there is increased demand on the knee extensors, anything related to overload, overuse, injury. Simple. There are some intrinsic predisposing factors as well that strains the tendon, such as there could be a ligament laxity, there could be an excessive Q angle, in fact, even the patellar height, the foot arches, basically, the limb length discrepancies, the tighter quad muscles and hamstring muscles, and BMI. So one more thing is why tighter quads and hams is because when we are sitting for prolonged period of time, there is weaker quads, so quadriceps has to work harder, and that overload irritates the patella tendon. That's why irritates the patellar tendon, and that's why there is an over tightness in the quadriceps or over extra. Okay, fine. Diagnosis is very simple. Pain location will tell you the exact localized pain, plus our swelling or our tenderness. and all these symptoms we can correlate and say that it is a patellar tendinopathy. And the rehab goes on as selective rest has to be given post acute overloading. Whenever a person is going for an activity, the sport activity especially, they have to take sufficient rest, selectively take the rest. They can start off with eccentrics and our heavy slow resistance exercises, eccentrics to concentrics. They can use kinesiotaping. It really helps in stabilizing the knee and taking that load from that tendon. And shockwave therapy is also proved to be very beneficial in these people of tendinopathy cases. Then we have our patella strap can be worn, and normally NSAIDs and certain corticosteroid injections are also can be taken by few. Plus over the counter NSAIDs can be taken.